Hi everybody, it's Heather from One-to-One Physical Therapy. In this video, I'm going to be talking about the physiological aspects of breathing. The last video we did, if you haven't seen it, is more about the mechanical aspects, and we called it The Truth About Belly Breathing. So if you haven't seen that, check that out for more of the mechanical aspects. This is going to talk more about our blood gas volumes, specifically carbon dioxide and oxygen, and what that means for our health. Typically we think we're breathing to take in oxygen. Oxygen is one of our most vital nutrients, and it's involved in 90% of our energy production. So we think we got to take big breaths to get all that oxygen into our body. However, the key is that it takes very little breath volume and rate to fully oxygenate our blood. The key issue here is getting the oxygen to leave our red blood cells and get into our cells, our tissues, our organs, basically our body. And the trigger that's going to do that is carbon dioxide. So carbon dioxide is not just a waste product, it's a vital nutrient. It's a trigger that's going to allow the oxygen to leave hemoglobin and get into our cells. So what does this mean for how we breathe? If you are breathing too quickly or in too big of a volume, meaning if you're breathing too much, you're likely getting rid of too much carbon dioxide. So your level of carbon dioxide in your lungs and in your blood is likely low. We call this kind of your set point, your baseline. And your nervous system is regulating this. Your nervous system is working and giving your brain directions on how to breathe so that you can maintain this habitual carbon dioxide level. So when you try to change it, when we do breathing exercises to increase our carbon dioxide levels, we have to do it in a very gentle way. Because if you do it too aggressively, your nervous system will perceive it as a threat and not adapt to a new set point and have a higher tolerance for carbon dioxide. So a really easy test to determine if you have too low of a tolerance for carbon dioxide, it's a Buteyko test. It's called the control pause. Patrick McEwen, who is also a very renowned Buteyko instructor, he calls it the BOLT, B-O-L-T, body oxygen level test. And it's very simple. You're going to do just some normal breaths. And after a normal sized exhale, you're going to pinch your nose and hold your breath until you feel a moderate urge to breathe. It's important that you don't go beyond that. The criteria is just your first urge, kind of a reflexive need to take a breath, and then let go, and you're going to time yourself. An excellent score is 40 seconds, good is 30, fair is 20, and poor is 10. And they've done studies comparing these scores to your overall health. Particularly in scores below 10, there's a higher chance that you have some significant health issues. So it's really important to try to get that score higher. To do that, we do what's called reduced breathing training. And this should be done at a bare minimum of 5 minutes twice a day. However, I have many patients that do it sometimes around 30 minutes per day. So what you're going to do is after a normal exhale, you're going to pause just a little bit. You want to pause so you start to feel a mild amount of air hunger. You don't want to go beyond that, because if you do, your nervous system is going to kind of freak out, perceive that you're under threat, and not really adapt to learning a new set point for your carbon dioxide. So for about 5 minutes, After each exhale, you're pausing, you're softening your breath. So you're slowing it down, and if you're taking big breaths, usually you're taking a little bit of a smaller breath, all around the perimeter of maintaining a mild amount of air hunger. After you've done this for at least 4 minutes, stop, breathe normally for about 1 minute, and then retest your control pause. If it went up a few seconds, it means you trained appropriately. If it stayed the same or it went down, you probably pushed yourself too hard. So that's one element of the training. The other element is that on a day-to-day and night-to-night basis, you really need to be breathing through your nose. When you mouth breathe, you're generating an air turnover volume of about 15 liters per minute, 12 to 15 liters per minute. If you breathe through your nose, you're generating about 6 to 9 liters per minute. So that's almost double. And this applies not only during the day, but also at night when you're sleeping. So if you are mouth breathing at night, you have to keep your lips closed, but you're thinking, well, how do I do that? One really easy and kind of silly technique is to use tape. I use what's called Hypafix tape. I have a little strip over my lips, and if you check out the article that accompanies this video, it'll show you a picture. But myself, my husband, my father, and many of my patients, we tape our lips at night to make sure they stay shut. And many people will say once they start doing this, they feel like they get a lot more refreshing sleep. And that's because you're getting more carbon dioxide and you're getting more oxygen. That's what you need to repair your bodies at night when you're sleeping. And I'm trying to think if I've talked about everything. And I think that's it. So generally, you should improve your score a few seconds each week. It's probably a good idea to take your score every morning at the same time, just to show a consistent progress, because it's going to vary throughout the day depending on the temperature, any food or drink that you've eaten, stress levels, air quality. So that way you have a better idea of how you're progressing. If you are unable to progress, if you're unable to tolerate this, you really need to seek the guidance of an experienced practitioner. So some people that really have a lot of medical problems, maybe they have some underlying chronic infections, people that have dysautonomia conditions like POTS, they have to usually have a little bit more structure and supervision when they're doing this training. So hopefully that helps, and you can check out the article for all of this information if you missed anything, and thanks for watching.